Welcome to the Nurse Edu Network. My name is Janae. In this video, we will continue to review practice questions for Domain 1 Facilitate Learning. A student is worried about missing the exam because she tested positive for COVID. What is the nurse educator's best response? A. Agree on a time to reschedule the exam in 1 week. B. Isolate the student from other students during the exam. C. Ask the student about their symptoms and when they started. D. Have the student bring in her test results proving she is positive for COVID. The answer is A. Agree on a time to reschedule the exam in 1 week. This is the best answer because it shows that the nurse educator demonstrates flexibility. Isolating the student is not a good option because they most likely also do not feel good and may not do well in the test. Answers C and D do not show that the nurse educator is willing to be flexible with the student. What strategy should the nurse educator use for students that are using their phones during class? A. Advise the student of the cell phone policy. B. Ignore the behavior because it's not disrupting class. C. Ask the student to put their phone away. D. Involve the student by asking them to look up information. Times have changed and the cell phone has become part of the classroom. Although the student should not be on their phone during class, Generation Y and Z enjoy using technology when learning. Option D is the best answer because it engages the student. Student wants to know why the heart rate needs to be checked prior to administering atenolol. What is the best intervention by the nurse educator? A. Explain that atenolol can slow the heart down, and that is why the heart rate is checked. B. Tell her to ask the patient's nurse. C. Ask her to look it up and share with the rest of the class during debrief. D. Review the patient's chart to find the answer. The best option is A. Ask the student to look it up and share with the rest of the class during debrief because it encourages active learning. All the other options involve the student asking someone else. By doing research, the student is developing critical thinking skills. All of the following are important in creating an excellent clinical experience for students and the clinical site except A. Gather feedback from the preceptors about the students. B. Reviewing the students' objectives with unit manager. C. Working with the clinical site to schedule orientation. D. Having the charge nurse make patient assignments. The answer is D. Having the charge nurse make patient assignments. This strategy may be acceptable at some sites, but not at all. Also, it is important that the nurse educator is involved to ensure students are meeting objectives. The rest of the strategies all ensure an excellent environment for students and the clinical site. Which generation of learners are more likely to enjoy traditional learning interventions like lecture? A. All age groups. B. Millennials. C. Generation Z. D. Generation X. The answer is D. Generation X. They prefer traditional learning strategies and prefer technology in only limited amounts. The other age groups do not prefer lecture as a learning strategy. A nursing student is reflecting on their progress of starting an IV. What step of Kolb's learning model does this represent? A. Concrete learning. B. Reflective observation. C. Abstract conceptualization. D. Active experimentation. The answer is B. Reflective observation is reflecting on a new experience to understand what it means. Concrete learning is when a student has a new experience or interprets a previous experience in a new way. Abstract conceptualization is when the student adapts their thinking or creates new ideas based on their experience. Active experimentation is when the learner applies the ideas they learn to a real-world situation. What is the first step in facilitating learning? A. Identifying what needs to be taught. B. Identifying learner objectives. C. Choose a setting. D. Choose a method of delivery. The answer is A. Identifying what needs to be taught. The nurse educator first needs to demonstrate what needs to be taught before identifying a teaching strategy to meet a learning outcome. Does the content require acquisition of knowledge, skill, or attitude? The nurse educator gives positive feedback during the simulation when a student completes a skill correctly. What theory of learning is this based off of? A. Social learning theory. B. Cognitive theory. C. Constructivist. D. Behaviorism. The answer is D. Behaviorism. Learning is based on observable changes in behavior. For students to achieve the change in behavior, they need practice and reinforcement. Behavior is shaped and rewarded to achieve desired outcomes. The nurse educator provides positive reinforcement through feedback so the student can meet the learning goals. Which of the following strategies should the nurse educator use to create an inclusive environment when working with diverse students? A. Use humor to make students feel comfortable. B. Address students by their last name. C. Make connections with students. D. Avoid using minority images in the presentations. The answer is C. Make connections with students. Nurse educators should be careful with humor because students from different cultures may not understand the humor or it could be offensive. Students should be addressed by their preferred name. Nurse educators should use pictures of minorities in their presentations. All of the following are strategies to ensure a civil learning environment except A. Provide effective feedback. B. Correct incorrect information from other educators. C. Provide open communication. D. Clear expectations. The answer is B. Correct incorrect information from other educators. Nurse educators should not talk about other educators in front of other students. In the next presentation, we will start Domain 2.